I always say start the planning phase for the NDIS as soon as you can, so maybe start figuring out what goals you would like to achieve over the 12 months and what people you feel would benefit by being at the planning meeting. So is it your carer, is it your therapy team, is it a close friend who has a good understanding of your disability, and just people who will be able to support your statements and also kind of prompt you if you do forget anything.
Yeah, they will be contacted from, depending on whether they're directly with the NDIA or with an LAC partner, but they would be contacted for a planning appointment.
Between being accepted into the scheme and having your planning meeting, it can be as little as 1 month to as long as 3 months at times. So start the planning process as quickly as you can because you want to be fully prepared for when it comes around.
So then a planning appointment would be conducted by the LAC partner, and then that's when we would go through all of the details, around support needs and what current supports you have.
So the NDIS has a heap of resources regarding planning and what services are available and what to expect throughout the planning meeting.
You'll need to use have your GP to help you with this, but of course it's probably good if you can set yourself some goals. What sort of therapy do you use, and so look at it as in these are the goals that you want to try and achieve, and this is how you maintain it.
It would be great to write down any questions, think about what your goals are and your support needs are. We would need to know what current supports you have already in place. If you'd like to have your planning meeting at home or at the office or over the phone.
So I think the face-to-face appointments are far better because they offered us a phone interview again, and David just said no way.
Yeah, I find I can't see things over the phone very well at all.
The best thing you can do is just go face-to-face.
Walk into an NDIS office if you can and talk to the people there because they're usually a lot more sympathetic.
In regards to, how much information you want to say during your planning meeting, I know that it can be tough for some people, especially if they've got a lot of pride and they don't want to let people know that they're struggling, but the NDIS is there to support you through those times. So being completely honest with them about where your capacity actually is allows them to provide the supports to allow you to improve.
I guess the thing we've learned, and a friend of mine told us when we were going back for our appointment, she said, don't sugarcoat it. She said, tell it as it is, as hard as that is. You don't want to look at the negatives because that can make you feel down when you start really thinking about how it's affected you. Like we try to be more, positive about things. We try to look for the good in the situation still. Because otherwise, it's that whole laugh or cry. We prefer to laugh. But when you're needing services, laughing doesn't help.
And be prepared with your goals. What are your dreams? That's what the planning meeting's all about, is putting supports in place for you to be able to achieve those.
So the planning meeting is very much based around a questionnaire speaking about how your disability impacts your functional capacity. So it will ask questions like, are you able to shower independently? Are you able to cook and clean independently? How is your social interactions limited by your disability? And my best tip is to always go with how you feel on your worst day, because you want your plan to reflect what your needs are on your worst days.
Some questions you give in-depth answers to, some questions are just yes, no, or don't know, really quick.
Planning meeting is quite a process, so it's important that we gather all relevant information and get the information that would be required to make sure the support needs are met. So the planning meeting can go from anywhere from an hour to 2 hours generally.
There are a lot of resources online. The NDIS has some great pre-planning tools on their website that you can work through with whoever you choose to. They also have a lot of online services, so different disability agencies have a lot of pre-planning tools. So if you're already linked with an agency, I would have a chat with them and see if they have any tools to assist you.
We're all there to put them at ease. This is their story, this is their journey.
I have an advocate who doesn't get paid, but she's an advocate for the NDIS, for us really. And I've sent a lot of people to her for help with their plans that they haven't even started yet. She's been wonderful. With that plan, I was able to accomplish so much. I improved so much in the last year.